So we all pretty much know what dance is, we all know what therapy is, and I'm pretty sure that most of you have an idea of what dance therapy is, but I intend on giving you guys like finer details about what it is, how it originated, what it's used for, and what a dance therapist does, and the actual benefits of dance therapy. So what is dance therapy? According to the American Dance Therapy Association, dance therapy is a psychotherapeutic use of movement to further the emotional, cognitive, physical, and social integration of the individual. So in simpler terms, it's pretty much a type of therapy that uses dance and movement to help the patient express thoughts, events, and feelings in a nonverbal way. And next, I will talk about the origins of dance therapy. There isn't really one specific originator of dance therapy, but there are a lot of people who kind of contributed to it and helped to develop it a lot. One of the people is Wilhelm Reich, and he looked at what and how clients repress things and designed movement exercises for them to be able to express things through motion. And Carl Jung gave patients a way to express unconscious material through their movements. Mary Whitehouse found connections between movement and symbolic material, and pretty much she owned a dance studio, and she would have people dancing and everything like that. And at the end of each session, she would have them talk about what they felt when they were dancing and help them kind of figure out the feelings that they had connected to it and everything. Marion Chase, started a dance studio that used an improvisational dance format. So basically, you would get up there and just do whatever either the music told you, what your mind was telling you to do, whatever you were feeling, and you would just dance it out. And then you would basically go back and look back on what you were dancing and figure out the feelings that connected to it. Irmgard Bartony founded the Dance Notation Bureau and provided a center where dance therapists could learn more. So it was pretty much a place where you could get better training and get more credentials for becoming a dance therapist. And the American Dance Therapy Association was actually founded in 1965, and actually the only way that you can become a legitimate dance therapist is by going to an institution that has been accredited by the American Dance Therapy Association. So now I'm going to show you a really quick video clip. Is actually like 5 minutes long, but obviously I can't show that. But you kind of get the gist of how she uses her body and all of her limbs to kind of express what she's feeling at that moment. This is actually a dance therapy audition, so obviously clients don't have to do things that are this intricate, but of course there are some who do things like this. All right, and now I'll talk about what dance therapy is actually used for. It's pretty much used for a wide array of things, from those who are physically disabled, victims of abuse, immunological disorders, those who are mentally challenged who have things such as autism or Down syndrome. And it's a wide range of ages. It goes from children to adults to the elderly, and also with psychological disorders such as depression, borderline personality disorder, multiple personality disorder, anxiety, things like that. And next I'll talk about what a dance therapist actually does. They pretty much function as the observer, listener, and container for the client's experience and productions. They pretty much help you to, figure out what you're trying to express through your emotions. They pretty much give you feedback and give verbal interpretations of the movements that you've done, since it can be sometimes hard for the clients to put their feelings into words. It's sometimes easier to just dance it out. Dance therapists see the body as a source of information, so movement pretty much expresses the inner thoughts of the mind, and there's a lot of symbolic movement, so dance therapists kind of try and look at the different movements and decipher what you're trying to say by it and what each means. And it can vary from like the way you move your arms, the way you move your legs. Each part of the body that you move can mean something different. And pretty much each session is guided towards the needs of the patient. So it's all about the patient and what makes them comfortable. And lastly, I will talk about the benefits of dance therapy. There are a lot of benefits towards dance therapy, and it can be either in a social or a group dance therapy session, and there's also individual dance therapy sessions. In the group sessions, it helps you work on isolation. It reinforces social and emotional bonds with other people. And it also helps to reduce anxiety due to the rhythmic movement of everything, and it increases your energy as well. It also enhances your self-confidence and trust in self, and it helps you express yourself in an easier and better way. It's also a great form of exercise, as most of you already know. And it also stimulates endorphin release, reduces stress, and heightens your positive feelings. So you end up leaving the session feeling more empowered and in a happier mood. And it helps you to release repressed emotions because it helps sometimes to let out the emotions through your body as opposed to through words only. And it also enhances your balance, your cognitive skills, your motivation, and your memory. So I hope you all learned a little bit about dance therapy so that if anyone ever asks you, now you know what it is, the origins of it, what it's used for, what dance therapist does, and the actual benefits